The Natural History of Pressure Injury Among Racially Diverse Nursing Home Residents. This is a student-led research project with Dr. Barbara Bates-Jensen and Dr. Heather McCreath. This is being presented by Erin Haglund and Connie Lim. This is a subsample of a larger pressure ulcer detection study. Data have shown that Blacks and Hispanics have higher prevalence, incidence, and severity of pressure injury compared to white nursing home residents, according to studies using administrative data. Also, there is limited primary data on pressure injury among ethnically and racially diverse nursing home residents. The aims of this study were to describe resident and nursing home characteristics of Black, Asian, white, and Hispanic nursing home residents with pressure injuries, to compare anatomic location, pressure injury severity, pressure injury characteristics, and pressure injury progression, and to examine the use of documented pressure injury prevention interventions among ethnically and racially diverse nursing home residents. 142 participants from 19 nursing homes in the greater Los Angeles area with all stages of pressure injuries were assessed weekly for 16 weeks. Monthly medical records, MDS abstraction, and Braden scale scores were collected along with weekly pressure injury assessments using the Bates-Jensen wound assessment tool. Pressure injury history was summarized using Q-sort methods to group visual assessments of each anatomic location for each participant over 16 weeks of the study with 4 patterns defined. Pressure injury present, all 16 weeks, 3 to 15 weeks, less than 3 weeks, and resolved. ANOVA, chi-square, and t-test were used to describe participant nursing home pressure injury characteristics, natural history, and to explore pressure injury prevention interventions. When evaluating nursing home resident characteristics, 62% of our study's participants were female. Black participants are younger in age, and Asians are older. More Blacks and Asians have a history of peripheral vascular disease, 29 and 26% respectively. More Asian participants developed pressure injury during the study, and we did not see a difference in nursing home characteristics.
For N2, we see more Black participants with persistent Truong pressure injuries and stage 4 pressure injuries. Asian and Black show more pressure injury in duration. We also found that Asian had pressure injuries with no granulation tissue and pressure injuries surrounded by purple-red discolored skin. Heel pressure injuries among Black participants were more often unstageable, show no granulation tissue, show 100% necrotic tissue, and along with Hispanic, show more deep tissue injury. In this figure, you can see that Black and Hispanic participants have higher percentage of stage 4 pressure injury, represented in red, compared to the rest of the ethnic groups. And Asian and white participants have milder severity of pressure injury, represented in yellow. In Figure 2, the time course pattern by ethnicity and anatomic location, green indicates pressure injury lasting less than 3 weeks, yellow indicates pressure injury lasting between 3 to 10 weeks, and red indicates pressure injury lasting all 16 weeks of the study. As one can see, more Black participants have pressure injury lasting the entire 16 weeks of the study for both heel and trunk. In this figure, it shows the natural history progression on pressure injuries in heel and trunk in all 4 ethnic groups. Green indicates resolved, yellow indicates cannot be determined, and red indicates persistent. We can see pretty similar finding across all groups. Pressure injuries were pretty evenly resolved among all ethnicities. In N3, we found that there is no significant differences as it exists in prevention and intervention between groups. In our study, we see that Black and Hispanic nursing home residents show more severe pressure injury and more persistent pressure injuries are seen among Black participants. These findings support existing administrative database studies. For Black and Hispanic participants with early pressure injury, surrounding skin may not exhibit erythema or discoloration. We also see that Black participants have more heel injuries and also have history of peripheral vascular disease, which may be a risk factor for heel pressure injuries. This supports others who have had similar results. While there is no significant differences in prevention and intervention between nursing home residents, we do see there is room for improvement for all prevention measures. Prevention measures such as the use of heel boots, use of nutrition supplements and vitamins are readily accessible, involve minimal labor and resources, and are quick and easy evidence-based intervention that could be implemented for all at-risk nursing home residents. In conclusion, health disparity found in primary data validates the results reported in administrative database research. Differences in pressure injury characteristics should be further examined among ethnically, racially diverse nursing home residents. Finally, room for improvement exists for prevention intervention for all nursing home residents with pressure injury. This concludes our presentation.